I was one of the first people to show that when you take elderly cells and you put them into a young environment, they perform just as well as the young cells in the young environment in terms of like cell replication, differentiation. My first company was a longevity company. I figured out that actually there are things that we can change in your diet and lifestyle to improve your longevity. We were using physiological parameters to determine your rate of aging and give you kind of a health number that was relating to various different elements of your health. If you have a fuller, more richer data set that you can look at longitudinally from when you're younger, and then see any changes and kind of trends that link into your health as you age, this is the most important thing that you can be doing to identify areas you need to focus on for your longevity.
Hey everybody, delighted to be joined this week by Tomasz George. Tomasz and I met at a roundtable actually on longevity, which I was asked to host. Goodness knows why I was asked to host this roundtable when I turned up, and Tomasz, with a PhD in longevity, startups in longevity, loads of work, and currently works in longevity, was there ready to completely disagree, quite rightly, with everything that I was saying, actually correcting me at every stage. So delighted to be on here, Tomasz, where now I can actually just ask you the questions and you can just tell everyone what's up in longevity rather than me trying to bumble my way through through a longevity chat. And also worth noting that you're a DJ as well, which is another reason why I'd love to have you on, because I want to spend at least 60-70% of this talking about DJing. So yeah, delighted to have you on, man. Welcome.
Great, it sounds perfect for me. And actually, that chat that we had was really illuminating for me. Like,
it was good, wasn't it? It was actually good. Like, I joke about it, but it was really fun, because you obviously come at it from like a really scientific angle and actually a really practical application angle. Whereas I was really more coming at it with my clinical hat on, I think fair to say, of like where longevity is about prevention and really like where's the longevity for everybody and how do we make that happen. So I was coming at it from there, and you obviously had loads to say on like the scientific breakthroughs and things that we're doing with certain mechanisms and you know, pathophysiology and physiology and all sorts. So it was like a super interesting discussion. But like, yeah, what do you remember from it? Because like I thought it was awesome.
Oh, so just kind of what are the main kind of things that you can focus on in everyday life to really improve your longevity? So like with diet, sleep, and all this kind of thing to really focus on, and also how we can trickle down some of the kind of higher end longevity advancements into everyday life for people, and what you can do as a just general individual trying to follow a good health journey, but what tweaks you can do to really kind of optimize that and make sure that you're not engaging with the healthcare system in a negative way as much as people do, and actually try and take a bit more healthcare responsibility for yourself.
Yeah, I think that's it, isn't it? It's really difficult with longevity, I find, when I think it's very alienating sometimes with longevity, the way that it's talked about by enthusiasts, and that's completely fair enough. They're enthusiastic about the minutiae of things that can optimize the human body to run slightly better or more efficiency or more clarity or more concentration or a slightly better cardiovascular system and all this sort of stuff. And it's alienating though, especially for people in the healthcare world, where like there's people that can't get decent housing and education to even think about getting up to a normal baseline. And so any longevity conversation for me that's credible has to at least talk about that trickle down, like you've just said. And I know that's what your latest work is doing in the startup and company that you're running. So like super keen to get into that. But obviously before we do, what type of music are you DJing? That is the most important question, because I haven't spoken to you enough about this.
Oh, so my favorite types of music are house and techno, and but also drum and bass, and but I have DJ'd in some rubbish clubs where I've had to play kind of pop music and things before, which isn't really my forte, but I have had to.
It's a very different beast. It's
Also,
very
numerous weddings as well. So
wow, God, so you've actually been like a paid DJ out in the real world. Wow, that's awesome. That's awesome.
yeah,
It's a very different beast, I imagine, trying to DJ the eclectic mix of BPMs that you'll get at a wedding versus the pretty reliable drum and bass, or house music 126, 128. Like it's or even dubstep, when you basically take drum and bass and halve it or whatever. Like it's at least that's
yes.
predictable. Whereas a wedding, like I guess you're struggling to have like a very good mix that you could probably get downloaded on
Yeah,
SoundCloud. It's not the most technical DJing, I imagine, or is it?
and
I don't
actually,
know.
one of the joys of DJing for me is the kind of technical aspect of it,
Yeah.
and
Okay.
like the beat matching, the
Okay.
matching of phrases, and like trying to
How do
create.
you feel about the sync button?
I don't use it personally.
So you are a proper DJ. I'm very intimidated right now that you're a proper DJ.
Well, if you want to use the sync button, it's great. It means it's more accessible to everyone, and
Well,
that's only one element of DJing. So, like, if you can't beat match very well, why not use sync? It makes it sound better.
For listeners, this is exactly what Tomasz was like when we were in the longevity discussion, just like silently negging me with these like phrases like the entire time of like how rubbish my, in this case, DJing is versus knowledge of longevity is.
Well, to be fair, like, I think we need to go back to back so I can see how DJing.
I would actually love that. Because you would end up seeing just how much the quality of the music changes when I can use the sync button and free myself from the cognitive load of the sync button to focus on the actual artistry of the music. So,
well,
when you've got
for
four
some
decks
people
on the
it
go,
works
when
really
you've got
well.
4 decks on the go, Tomasz, and you're beat mashing that by ear and you're managing to keep them all in sync, then fair enough. But and you're probably going to say that that's what you do regularly. So let's actually move on.
No, 3 decks is the maximum for me, really.
Even 3. It's just fair enough. Right, we're going to move on to some health tech. So we talked about your DJing. Tell us what's in your story, man. So tell us where it all begins. Run us through the career.
Actually, why don't I start with the DJing? That's quite fun point. So at university, I basically with a few mates, we decided we wanted to set up a club night as a kind of a student night, but we thought, we're fed up with all these rubbish clubs that run student nights in London. Why don't we approach Fabric?
Wow.
Which is like Fabric, if people don't know, is one of the longest running clubs in the world. It's a mecca for underground house, techno, drum and bass, and it's been going since 1999, I believe, like many years. So we approached them, and one of my friends was, he's got the best chat ever. He just basically can go up to anybody and convince them of anything. So he made friends with all the bookers at Fabric and convinced them that they should run the first student night there.
Wow.
So their stipulation for this was that we had to basically book artists that they would be happy booking themselves.
Okay.
So we had to have huge headliners. And so we found out with 2 weeks before the first event. And I put my hand up and said, I want to be the resident DJ. And at this point in time, I couldn't DJ at all. So I basically taught myself in 2 weeks how to play a short 1 hour set. And I just played it kind of from memory as to how to mix it and everything.
Sure. Which can be done, to be fair. I mean, fair play to you. You must have had a natural talent.
That was my first foray into
DJing.
Wow. It was on the stage at Fabric playing to 200. It was playing to 2,000 people round about.
Unreal.
And it was warming up for Calvin Harris.
That is ridiculous.
But this was when Calvin Harris, he just released Acceptable in the 80s. So he was kind of a household name, but he wasn't quite the level that he is now.
What a flex, though, man.
He was literally only just starting out DJing, but I was his first warm-up act at Fabric.
So I have a question on that. So how did you feel playing that? Did you actually enjoy it?
I was petrified.
Yeah.
But I really enjoyed it.
Did
as well.
you? That's so good. That's so good that you got to enjoy it.
you get a rush from putting yourself into these challenging situations.
Yeah.
It's like nothing else.
Wow.
And actually, when you put yourself into those kind of situations where it really is challenging you, and like your sympathetic nervous system is just in overdrive, you just feel like you can cope with anything else. And actually, like looking back on that, it's meant in being able to cope with situations like that where you're DJing in front of thousands of people, it's really helped me in my business journey down the line.
Thank you for linking it to business, but I'm actually going to ask you one more question to make sure that anyone interested in Healthtech will definitely switch off by this point. Do you have a track that you can that transports you back to that moment? Do you have one tune that sort of gives you that memory again? And if so, what is it?
So
probably acceptable in the 80s that Calvin just spins afterwards, and you're like,
we also booked Dizzy Rascal to play Fabric.
Sick.
And this was when he just released his most seminal album, which I can't remember the name of right now. But there was a tune on it called I Love You, which is one of the darkest grind tunes. And I remember I was just finished my warm-up set for Dizzy, and he came on, and that was his first tune, and it just destroyed the dance floor. It was amazing.
That is unbelievable. And as you say, what an incredible thing to go through, to know that you can learn something in that short space of time. You can then get on stage. You can do it. That's so cool. That's so cool.
But also, like, when I started out DJing, I used to screw up while I was DJing quite a few times.
Of course.
In front of loads of people, and as long as you kind of like get away from that screw up as soon as possible and get the music back on, or stop the beat match properly, then
if you press pause on the wrong deck, it all goes quiet.
Exactly.
Which does happen.
Situations.
Yeah. Oh, that's awesome, man. So what happened? So how old are you at that point? Was that, you said that was university, right?
Yeah. So that was 2003.
Yeah.
And how old was I? Like early 20s.
Yeah.
22, 23, something like that.
And what were you studying at uni? What did you do?
So I studied human physiology at UCL. And then, I was DJing just at the end of my undergraduate, but then I got accepted to do a PhD at King's in London after that. And I had a kind of semi-professional DJ career off the back of the Fabric thing, where I was touring with Faithless and with Pendulum for a little while. And kind of playing in random places in London where I could sometimes play the music I wanted to play, but not always. And
I'm sure I'd cope if I was back to back with Faithless.
Oh yeah, Faithless are amazing.
Oh.
So we actually went to Ultra Festival with Faithless.
Oh yeah.
And
which one?
Miami. So this was Ultra Music in Miami.
Yeah, Miami,
yeah. I don't know. I think this was the first one, and they've expanded since then. But this was the original Ultra. And we were playing in a club that was off Ultra. We weren't actually Faithless were playing Ultra, but myself and my DJ colleagues, we weren't quite at the level to play Ultra yet. So we played in a club called Park Central that was in Miami, but still quite big. But we were the opening DJs, and then after we had Khalees, will.i.am, and David Guetta following us in one club.
Unbelievable.
But then we went out on an after party with Faithless and went to the club next door, which was called Space. And there's a DJ called Adam Beyer who was headlining.
Wow.
And if you've ever seen Adam Beyer, he's a very tall Swedish guy.
Yeah.
Looks nothing like me. But I managed to convince the bookers on the door at Space that I was Adam Beyer and I was due on the deck.
So this is where the entrepreneurship starts to shine through here.
So we all got in for free, and Yeah, so my DJ career kind of helped fund my PhD, which I
Mm.
was doing at King's in aging and longevity.
Mm.
And yeah, so on the stipend that they gave you at the time was something like 14 grand a year,
Yeah.
which was tax free, and it basically just about got me by in London at the
Yeah.
time. It
Just over
wouldn't get
grand
you
a
anywhere
month.
near these days.
No, you struggle now, yeah.
But I had to supplement it somehow, so the DJing did a lot for that.
Absolutely. Yeah. Nice.
So it was fun.
Nice.
But yeah, my PhD involved like aging and longevity, where I was one of the first people to show that when you take elderly cells and you put them into a young environment, they perform just as well as the young cells in the young environment in terms of like cell replication, differentiation. So I was looking at muscle in particular, and one of the key things with aging is something called sarcopenia, where everyone loses muscle mass with age.
Mm.
And this happens in the healthiest and elite athletes as well.
Mm.
But kind of a pure form of aging is looking at muscle reduction with age, because even someone who's the super healthy for their age and an elite athlete for their age, they still lose muscle mass at a kind of steady rate.
Right.
But then there's a point at which, over about the age of 75 to about 83, where there's a steep decline in your muscle mass. And that's due to kind of dysfunction with aging. But you have like a general decline up until that point, which is just your kind of base level of aging.
From what age do you start declining?
So in your 30s, really.
Wow.
So, but then significantly from kind of 40 onwards, really.
Hmm.
So it's it's quite an interesting model to look at for aging. So we were actually taught, myself and my team at King's, how to do an operation on people to take a muscle biopsy.
Mm.
And because we were taught, because the labs I was in were associated with Guy's Hospital in London Bridge, we were able to get taught by a surgeon how to do it, and it came under the insurance of the hospital.
Oh, wow.
So even though we weren't doctors and we weren't kind of surgeons, we weren't trained in medicine, we could still perform an operation.
Daily Mail headline incoming after they picked that up. That's quite an interesting one.
Yeah, so but we were trained to the full extent and could perform it really well.
Yeah, of course. I'm joking.
So we performed numerous operations, and I actually got a load of my mates in, paid them 20 quid, and said, like, sit down, we'll give you a local anesthetic in your leg.
Yeah.
Take a tiny bit of your muscle, extract the stem cells from your muscle, called satellite cells, which are the ones that regenerate your muscle after you damage it.
Okay.
And those were the ones I was looking at as a model for aging.
Right.
And but we could perform these operations, get people healed up, pay them literally nothing, like 20 quid at the time, and send them on their way.
Wow.
So I had a load of my friends.
But those cells perform. But the young cells perform just as well as the old cells, you said.
Yeah. So it's down to the environment that you put the cells in terms of how they respond in terms of regeneration.
And what parts of the environment?
So this is one thing I was looking at. So I was taking the stem cells, the satellite cells, which are the muscle stem cells from elderly and young people.
Yeah.
Then you culture them in a petri dish and treat them with either elderly or young blood. And when they're treated with the elderly blood, they perform really poorly in terms of their regeneration. When they're treated with the young blood, they perform really well. And this is regardless of the age of the cell. So you have the young cells that perform really poorly in the elderly blood, and the elderly cells that perform well in the young blood. So then I was intrigued by this. So I was looking at what factors were changing in the blood that were kind of either going up or down with age, that's then influenced the regeneration of these cells. And I kind of highlighted a few of them initially, but now I think there's more and more being identified each day. There's like 50 plus factors now that people have identified that really affect the aging process that are in your cellular environment.
Right.
And you can influence these through diet and lifestyle in lots of instances as well.
Right.
Or you can take supplements and things like testosterone replacement therapy and things like this as you age, growth hormone, these kind of things that are done at the high level of longevity treatment do go somewhat to changing your cellular environment back to an earlier stage.
Interesting.
But then a lot of people, after my research and other people's research at the time, showing that that the young blood regenerated the cells, they decided that, I can afford it, I'm going to pay for a blood transfusion.
I was going to say, is this now going to be a thing? Yeah, okay.
Yeah, so at the time, there was kind of a bit of a fad in Silicon Valley and places like this, where people were taking younger blood and injecting themselves with it. And not always in the most healthy of ways, because some people didn't really match the blood effectively, got kind of sepsis or immune conditions from it.
Oh, God.
And I actually heard as well that Robert Mugabe started doing this after people like myself and others researching in this area. So unfortunately, we might have gone some way to improving his life.
Wow. So before we move on in your journey, just a couple of questions on this because it's fascinating. What then happens at the age of 75 that's, correlating with this sharp decline then? What is it about not the quality of blood's the wrong phrase, but what are the physiological processes in the body that then start happening or not happening or increasing in speed or reducing in speed? What happens at 75 then that causes such a sharp decline?
Well, there's a number of factors that really affect it, I think, but we still don't know exactly.
Right.
So there's telomere length that plays a role in kind of regulating.
Just explain that for people that might not know.
Right. So telomere length is the on the end of your DNA. So each cell in the body has DNA, and they're split into two strands. And when a cell replicates itself, those two strands come apart, and they replicate next to the kind of separate strands to form two separate copies of the full DNA. But on the end of the DNA, there are these kind of caps called telomeres that are part of the replicative process, but they get reduced by a small amount each time with every replication. So they don't code for anything on the end. They're just basically like a bit of, if you look at kind of rope that's coiled up, and if you were to uncoil the rope and then coil it up again, you might not be able to coil it up exactly the same as it was before each time, and you might get a bit of frayed end on the end. But every single time you get that more, you uncoil it and coil it back up, you'll get a bit more of a fray on the end. So that's what the telomere is, to stop that kind of fraying end. So this, and it's a part of DNA that doesn't code for anything in the body, but it's just there to kind of protect the DNA that does code. So when you get that frayed end and it becomes too long, and it gets close to the DNA that actually would code for something and could cause a mutation if it was to replicate again, then the cell programs itself to die, because it doesn't want any of that DNA that it's trying to replicate causing any mutations that could really affect the body as a whole. So it's kind of like it's a protective mechanism on the end of your DNA, essentially the telomere. But the shorter it gets, the more chance that cell is not going to be able to replicate again. It will just die. But you do get certain cells that kind of go into apoptosis, which is like cell death, and they die straight away. But you get some cells with the aging process that go into that become kind of senolytic cells. So what they do is they go into a state of like kind of where they're like a zombie cell. Instead of dying, they're half alive.
Okay.
But they produce lots of negative factors that influence the cells around them to also die. So you'll have healthy cells that are next to these senolytic cells that are influenced by them to go through like the death process as well. So one of the best treatments for aging is actually to target these senolytic cells and kill them off, so they're not infecting other cells around them. And there's various things. So there are certain drugs now that are being developed primarily for that, but also things that you can do in your diet and lifestyle seem to have a senolytic, an effect on these senolytic cells as well.
Senolytic cells, right? This is really interesting, man. So I'm learning loads here. So
one that's quite good is green tea as one of these good compounds that kills off these cells.
Interesting.
So that's one, and also kind of these cells add to the inflammatory process with age, and the inflammation is one of the key elements that affects the entire body as you age and increases in everybody along with the aging process. And this then affects the cells in a negative way by exposing them to negative factors in the body and causing them to dysfunction as well.
Wow.
So the more inflammation you accumulate over the aging process, the more it's going to affect your body's aging, and that's one of the factors that causes that decline as well.
Wow.
So there's a few things, but we're still in early stages of exactly knowing the full process. Okay. But we are now developing certain drugs that can kind of help combat that. But there's certain things you can do in your diet and lifestyle to really help combat it also.
So I think that's worth touching on now. So just pausing your personal journey at this point to focus on some of this. So diet and lifestyle versus drugs. I think this is a really interesting thing in longevity, because diet and lifestyle obviously accessible to everybody. And we'll sort of generally, it will feel like, oh, okay, that makes sense. That's what we've always sort of thought. So there's a lot of those things. I'm interested in sort of going into that in a bit more detail with you as to maybe some mechanisms there and some interesting things you could pull out of there. But then there's also the drug side, like you've said. And the drug side is funny as me coming from this from a doctor. And I'm going to be like as honest as I can here of we're taught in medicine broadly that you've got a problem, and you can fix that problem with lots of things. One of them is a pharmacological intervention, and that's aimed at the problem, and that's that. The idea of using drugs in this what feels like really experimental way that might affect senolytic cells that are absolutely fine as they are, by the way, and aging is normal. So to then start using medication to affect these not even pathophysiological, but physiological things that are happening in the body, that you might define that as pathophysiological. So you might define aging as a problem. I don't know. That's an interesting philosophical debate. So it's weird to me. Like, it's weird. Like I find myself like now I feel like a bit like, oh, that seems a bit odd and a bit weird. But there's people that obviously really like this and think there's value in this and are feeding this to their dogs so that their dogs can, like, which for some reason seems okay. I don't know why this is all of a sudden okay in veterinary medicine to just like anti-age your dog. But
interestingly, another business I'm involved with is a pet longevity.
Yeah, nice.
So
yeah,
chat about this.
so there we go, and we can definitely talk about that in more detail. But talk to me about that then. Talk to me about the diet and exercise components and how important is that? And yeah, just talk to me about that side of the world first.
So exercise has been shown to be one of the key things, probably the most influential, to exercise and kind of sleep and stress and inflammation on the aging process. So if someone exercises to a certain level, not overdoing it, but exercises to the right level as they're aging, it's one of the key differentiators to reduce that risk of the aging process. And this doesn't have to be extensive exercise. You don't have to be running marathons every day. But in fact, like the more if you are a marathon runner or someone who pushes themselves over that limit and to the extremes, that's actually quite detrimental in the long run.
I actually saw the link between, marathon running and I think it was it polyps that can then turn cancerous and things like that, because you're really significantly affecting the blood flow to your colon, and they get a lot more kind of PR bleeding and stuff like that because of various different mechanisms. And actually, I think that was ultras. That was the ultra marathon runners that, again, there's like a common sense there as well, like running 100 kilometers like 5 times in a week or whatever that ridiculous challenge is. Just obviously he's like, okay, that probably is a bit far, but Yeah, no, there are like clear mechanisms to this, but that's not an excuse
Yeah,
to not go running.
your body's
because
not
there's no.
designed for that.
Well, most people's bodies, mate, are not. You couldn't possibly push yourself that far. So, like, I think the message still has to be like, go and go for a run. You'll be fine. You're not going to hit the detrimental part without doing that. But clearly, the mechanisms here are interesting to me. About, like, when people think about exercising, especially as they get older and into aging, they might think about it as, stopping gaining weight, and like it's quite rudimentary. I think when you look into this kind of research, I imagine that like the losing weight thing is probably paling into insignificance when you're thinking about things like even senolytic cells or whatever. It's you tell me, but that's what's interesting to me.
I think the weight is just the weight is a kind of outward symptom of a lot of the elements that are happening internally that are detrimental.
Right.
So it's not the fact that you're overweight that's the key. It's the inflammation that's related to being overweight.
Right.
It's also, I think, the diet that leads to you being overweight, causing causing gut dysbiosis and like things to be coming over the gut barrier between the blood and
explain
and the
gut
gut
dysbiosis to me.
Oh, okay. So it's like where you.
I don't think I've ever heard the word dysbiosis before, which is quite interesting.
Okay, so basically, you're in your gut. You have a number of cells that cause that open to allow for nutrients to come through from your food into the blood, where it can be used by the body. But if there's inflammation in the gut that's been caused by eating certain foods like processed foods and like other kind of conditions like inflammatory bowel diseases, this kind of thing that can be caused by food but can be caused by genetics as well. And then if you're not eating enough fiber, this can affect your gut in a negative way by like not preventing some of that inflammation. And whenever you get inflammation in the gut, so the cells that form the gut lining, they're not quite as tight together as they should be.
Interesting.
So when they're inflamed, they can actually cause gaps that appear in between the cells that where nutrients that you might want to keep out of the blood then can transfer through into the blood. And this can then lead to the body reacting to those nutrients in an inflammatory way. So it causes systemic inflammation.
Right.
So the ideal gut system would be to have your gut cells that are very close together, and then the gut cells have their own channels that allow for the transfer of nutrients that you want in the blood through them.
Right.
So if you allow the gut to function as it should do, where it's kind of gating what nutrients come in and what nutrients don't, then you have a healthy gut, and that's not a dysbiotic gut. If you've got gut inflammation, if you've got kind of larger gaps between your cells that are causing some of these negative factors to travel from your food into your body, then that's what gut dysbiosis is, and that's causes negative connotations in terms of inflammation, and your body's constantly having to fight against these elements that you don't want there.
I see. I understand.
And then this is also linked into your microbiome. So if you are eating the correct diet that feeds good bacteria in your gut, they can produce factors that help you to break down the food better so that your body can absorb the nutrients more efficiently. But then there are other negative bacteria that sit in the gut as well that can be fed by certain other foods, foods like processed foods and things that you don't want to be eating. And those can cause these inflammation factors that then act on the gut cells to cause them to split apart and allow these nutrients through that you don't want to be there.
It's really interesting to me how I think a lot of the messages that we receive about, for example, not eating processed food. I am partial to a big bag of Doritos every now and again, like very, very partial. And this is not an advertisement for Doritos, but if it's a Saturday and I've been eating really well and exercising and I want a cheat day, like that's what I'm going to go for. I'm definitely going to go for that. I don't think I've ever had I obviously get the messaging through that you shouldn't eat processed food, or you shouldn't eat this, you shouldn't eat that, you shouldn't eat the other. I don't think I've ever passively had the explanation of what you've just talked about, or any kind of actual cellular or tissue level explanation as to what's actually going on with that stuff. And I think that research is so important, because it also works both ways. Because one of the companies that Jessica and I, in fact, we've just done our very first angel investment into a company called Booby Biome, which they are 4 PhD scientists that have mapped the breast milk microbiome. They've isolated what the good bacteria in inverted commas are. They've first of all realized that the best ones are anaerobic, so that we're storing breast milk completely incorrectly. And that they've developed now anaerobic storage for breast milk, so it can sit in the fridge for 4 days and be absolutely fine. And they're developing a supplement so that every baby globally can benefit from breast milk, even though not every family can give that to their babies, which is obviously incredibly important.
Just on a slight tangent
Yeah,
here,
yeah.
I was very premature when I was born.
Really?
So I was 6 weeks premature, and in 1983, that was quite early.
Punchy, yeah.
So it was touch and go whether I would survive.
Wow.
And because it was really early, my mother had struggled to produce milk.
Yes.
So I actually had breast milk from all of the other mothers in numerous hospitals given to me. And I don't know if that would happen these days.
Wow.
But I think that's probably helped me, because I've had all those nutrients and all those different kind of bacteria and all that microbiome from each of those other mothers that was given to me, which probably helped me to survive when I was a premature kid.
Definitely. And I think what I'm most excited for in this, as we go forward in healthcare, is that I think the information about something like the microbiome is starting to permeate into society more broadly as we all get more interested in our health, and as information just does start to get more democratized. That it's, I think however we want to define this, the quality in inverted commas of the microbiome, or how good it is, or better, or I don't know what the right words are going to be, or balanced, or whatever it is, but I think we're gonna end up probably on some level, or at least some people, with a framework that's around keeping the best possible microbiome up, which is then a great framework for me not reaching for that bag of Doritos, knowing full well that some cells are going to pull apart in my gut, and I'm going to get some dodgy proteins that end up in my blood that I didn't want, and that's going to cause an inflammatory reaction, all these different things. And I think it's going to be a really interesting frame, because we're so willing to talk about it in terms of, infant health and neonatal health, and it obviously being so important. And as a new parent myself, man, you can sort of feel it, the colostrum conversation that they have with you. They know those first drops are so important, because they're packed full of this, that, and the other. And you're looking at this little tiny thing and you're like, oh my God, if you get it right immediately now, we might prevent loads of down the line. So there's this almost instinctual thing to it as well, as a new parent, that I think if we can start piggybacking on this to introduce some of the longevity science that you're talking about, and actually telling people that certain mechanisms are at play, I think it can really help.
No, I certainly agree. Yeah, and actually, I think it's not as detrimental as you think to have the odd bag of Doritos.
Thank God. Thank God. Because that's not stopping, because let's also be realistic.
Because, I personally think that the one of the primary things that affects longevity and health is stress. And if someone gets super stressed because they've had a cheat day and they've had a few Doritos, or they've had a burger, then that's actually more detrimental to you than having the burger itself.
Interesting.
Especially if you've developed a gut microbiome that isn't influenced by that burger. So if you have a burger every day, it adjusts your gut microbiome in a negative way. Right. If you have a burger once every 2 months, your gut microbiome isn't going to be adjusted that much, and then it's going to kind of go back to the level that it was before when you continue healthy eating the next day. So It's not as if every single meal causes that inflammation in the gut and causes that
Interesting.
like change in your gut microbiome as much as you think.
Mm.
And your gut microbiome and the inflammation is constantly being adjusted. So if you get a slight inflammatory effect from eating your Doritos, but then counteract that with loads of good fiber and like good nutrients the next day, that inflammation is going to be very, very transitory and just
Right.
kind of like you'd have a very small effect of it maybe just after eating,
Sure.
but it's not going to last.
Sure.
And it's the long-lasting effects of that inflammation that causes this gut dysbiosis that we were talking
Interesting. Okay. So thank you for the dysbiosis lecture. That was really good. So stress you mentioned as well. And not assuming that you're an absolute expert in all of these different things, but again, I think
about. I'm not, and I'm sure you'll have lots of listeners
no.
that come in and say, "Look,
We definitely you're misrepresenting the audience of this podcast if you think that's true." So the stress component as well. We learn about stress in anesthetics in a very sort of physiological way for those exams, and we'll learn about cortisol and adrenaline, and we'll learn about short-term impacts and some long-term impacts and things. But the stress that we're talking about with longevity, I assume, is probably slightly different. This kind of fluctuating between low and high grade stress that we get in the modern Western world, over the course of decades is going to be slightly different to, I'm so worried about this thing, this saber-tooth, the classic saber-tooth tiger chasing me response that we might learn about in terms of how you metabolize your sugars. So what really is happening with stress and longevity?
So I think it's one of the key elements, and a lot of my first company was a longevity company. So after the PhD, I figured out that actually there are things that we can change in your diet and lifestyle to improve your longevity.
Yeah.
So the first company that I had was called Health, and we were using physiological parameters to determine your rate of aging and give you kind of a health number that was relating to various different elements of your health.
Okay.
Using kind of a functional medicine approach where it's like taking different elements of your health, so like your cardiovascular health, your gut health, your stress, your nutrition, looking at kind of your kidneys and liver and all these different elements of the body, and kind of weighing them together as opposed to treating them as isolated systems to see how they're functioning as a whole. And one of the key elements to this was stress. And we used a system that looked at your sympathetic and parasympathetic balance of your nervous system.
Okay. How?
So your nervous system split into kind of two elements. So when you say that your stress kicks in to kind of take you away from the tiger that's chasing you, that's part of your sympathetic nervous system response. So when your sympathetic kicks in, it raises your heart rate, raises your blood pressure. It takes the blood away from things like your digestion that's not really needed when you're running away, and puts it towards your brain and your muscles so that you can function better and run faster away from the tiger. And there's a equal part of the nervous system that's contradictory to that. So there's your sympathetic, which is the stress response. The parasympathetic is your rest and relax and digest response. So this kicks in when you're sleeping, when you're sitting down, digesting your food. After you've run away from the tiger and you're in a safe place, your sympathetic nervous system should switch off and your parasympathetic should take over to allow your body to recover from that exertion and also digest your food and kind of provide that nourishment for the rest of your body. So normally these things work in balance. So whenever your sympathetic kicks in, your parasympathetic then kicks in to balance it out. So immediately you have this kind of homoregulation of your nervous system that's happening on a millisecond by millisecond basis, where they're kind of in balance, going one's dominating, then the other kicks in to dominate over it. And when you're in a healthy stress response, that's what should be happening. In today's society, where we've been exposed to so many different stresses, and even things like being on screens all the time is a stress that we don't even think about. And kind of environmental factors from living in London and being exposed to traffic and to like tourists and all this kind of thing that stress you.
Famously incredibly stressful, yeah. A walking pace.
If you ever try and walk down Oxford Street and try to get somewhere quickly,
very stressful.
Very difficult. Yep. yeah, exactly.
They can't pedestrianise that street any sooner, honestly.
I agree completely. So yeah, there's all these stresses that are just of everyday life that you don't even think about. But what they're doing is promoting your body into a state where your parasympathetic is at a lower level and your sympathetic is always at a higher level. And you can actually train your nervous system to respond better. So one of the tests that we did within this kind of suite of tests that we had at my company was looking at your sympathetic and parasympathetic nervous system balance. So we looked at it while you're at rest, and we could see if you're in a state of anxiety.
How, by the way, how are you measuring that?
So we looked at we could look at it from your heart rate and your changes in heart rate over time. So it's something called heart rate variability, and if anyone's got a wearable like a Fitbit or an Apple Watch or Aura, you can look into the app and see your heart rate variability. And that those companies and those wearables, they look at it over time, normally while you're sleeping, so you don't really it's not influenced by your everyday activities. But you can get a level for your heart rate variability that relates to how well your nervous system is functioning. And the higher level in general, the better for heart rate variability. But when you look at it in a short-term response, you can see actually how the balance between your parasympathetic and sympathetic are working, because you can see if there's a large amount of variability in like your heart rate kind of going up and then slowing down within say a 5-minute period, and you're constantly seeing it speeding up then slowing down, speeding up then slowing down. It shows that your two elements of your nervous system are working very well together.
Oh, interesting. Okay.
And so that's what things like heart rate variability, when you look on your wearable tech, is telling you,
right? How
well your nervous system's working. And at rest, they should be in complete balance. So if your parasympathetic is depressed and your sympathetic is elevated, it shows that you're in a state of anxiety and stress that you should probably work on. And you can do breathing exercises to help this, or often people might be a bit deficient in magnesium, and magnesium helps boost your parasympathetic as well. And this is one thing actually that declines quite a lot with age, is magnesium, and it's a supplement that a lot of people should be taking. Then what you can also look at is how your nervous system responds to certain activities. So one of the things we did as part of this test was having you at rest to look at your nervous system balance, then asking you to go from like lying down to standing, which is called an ortho test. And ideally, when you go from lying down to standing, this is putting kind of a mild stress on your body. So your sympathetic should kick in and your parasympathetic should back off to allow your blood pressure to cope with that, blood pressure to increase to cope with that kind of change in your orientation. So the blood gets forced up to your brain where it's needed. And if that doesn't happen effectively, this is why when some people get up from seated to standing, they can get kind of lightheaded. And that might be because your sympathetic nervous system is not kicking in as effectively as it should do. But also with other people, when you stress the body, their sympathetic does kick in, but it also lasts a lot longer in terms of a stress response. So when you look at this ortho test, you can look at it over time and say, actually, your stress kicked in, but did it go back down to normal in the appropriate time for you as a 40-year-old guy? And if it doesn't, if it takes a lot longer, then it means that your nervous system isn't functioning quite as effectively as it could do.
So the modern world causes those issues, basically.
And there's exactly, and there's but also diet and lifestyle, but also kind of you can train your way of thinking and you're kind of you're there's a test, a kind of treatment called biofeedback that allows you to kind of associate your breathing to your heart rate a bit better. So when you do breathing exercises and yoga and meditation and these kind of practices, that teaches your breath work to work with your heart rate, so that actually when you're breathing in, your heart rate is slowing down, and when you're breathing out, your heart rate is increasing. And this helps to train your nervous system to work in an effective way, because it's essentially activating your parasympathetic and your sympathetic in line with your breath to train it better. So then it will work better in situations where it's needed for stress or for relaxation.
I have just a very like personal moment of delight whenever I see like ancient wisdom collide with modern science, and this seems like one of those moments where you've got these like thousands and thousands of years old practices that researchers in 2025 turn around and go like, oh, we should just be doing these things. Yeah, we've been doing that.
Yeah,
don't worry about it. We figured this out quite a while ago. Like,
well, yeah, but what I love though is like people figured it out ages ago, and it's kind of been lost, and people think, oh, like, yeah, that's an ancient practice, like there's no evidence for it, like we're just going to disregard it. But then what I love is when the evidence comes in to prove that was actually something we should be doing.
Yeah.
And then it kind of comes in a cycle where people think, oh, I'm going to be doing this practice again. Like, whereas in fact you probably should have just been doing it all the time.
Yeah. So, no, quite, and trusting that ancient wisdom, I guess. What happened with that company then?
So it was a bit early in terms of longevity company. So we started this in 2009. If it had been like 10 years later, I think it would have done a lot better.
That is early.
Yeah. So, and now there's been a huge longevity boom since then.
Yeah.
But we had to kind of pivot the company at the time to being more of a kind of corporate wellness assessment. So we were working like reasonably successfully for a time with kind of corporates doing health screenings, that kind of thing. And but then I didn't see the company progressing the rate that I wanted it to, so I moved on to a different one after that. Actually went to work for a cancer company after that. Cool. They ran a load of cancer clinics globally. It was called Verita Healthcare Group.
Nice.
So they had supplements that they were offering for cancer treatments in I think 6 or 7 clinics globally. And also they wanted to set up a digital arm that was utilizing my expertise in like AI and health tech to develop an app that would help patients optimize their diet and nutrition around any cancer treatments to get the most out of their treatment with the least side effects. So that was developed in, actually that was scuppered a bit by COVID, unfortunately, because we had to have all of the cancer patients that were being treated in clinic. We had to spend a load of money to get them actually the same treatment, but in their homes instead of in the clinics, because we couldn't afford them
trials
to get
were
COVID.
Just a nightmare.
Yeah. So actually myself and a few other people on the management team had to basically take zero salary for 6 months there. And while the company hopefully got back on its feet, but it never did, and they had to scrap the digital arm of the business. So, but thankfully, in the meantime, I'd moved on to doing another 2 businesses. So it was
You're
kind
hard
of
to keep down, aren't you? Honestly.
So yeah, the first one I kind of I noticed during COVID that one of the key elements of the immune system that actually works to fight off COVID were T cells in the immune system. So I developed a test for T cells.
You developed a test for T cells?
Yeah.
Okay.
So how it works is you take a blood sample, you treat it with a proxy for a virus.
Yeah.
So we had a proxy for COVID,
right,
which looked like basically all of the cell surface markers on COVID. So you could see how your blood was reacting to that proxy, and then it would hopefully react in a similar way if you actually got the COVID virus itself. So then we treated the blood with this proxy, and we could see if your T cells were being activated in response to the COVID proxy.
When you say you could see it, are you talking down a microscope, or are you talking through a different?
No, so you looked at kind of the T cell activation as so T cells, when they get activated, they release certain markers that you can detect in the blood.
Detected those.
So we could provide a kind of a blood detection system that could see how many of these activation markers were being produced by the T cells. So if your T cells were very active in response to the COVID or the COVID proxy, we could assume that actually if you got the virus, you would fight it off pretty quickly and you might not get serious effects from COVID. So we were designing this for use before an outbreak, when you had identified that a virus could be an issue.
Wow, yeah.
So that actually, if there was a virus in, say, like China, that had been identified as potentially causing a pandemic, we can quite quickly create a proxy for that virus, adapt the test so that we can treat someone in the UK to say, like, take a blood sample, treat it with this viral proxy before the virus gets to the UK and there's an outbreak, to say, actually, look, you're going to respond quite well to this, so you probably should be further down the line in line for a vaccine, whereas other people don't respond very quickly to this virus. They should be front of line for a vaccine. Or
in marketing, that's the way around you want to sell it. Like, these people really need it, so they go first. That's definitely the messaging. But no, that's incredible, man. That is incredible.
Also, some people, like, there's been a big backlash on vaccines now.
Of course.
But if you can have a test prior to the vaccine to say, actually, you don't need it, or you do need it, people are going to be more inclined to take up the vaccine.
You are right. That is correct.
So, and actually, it's going to be people who are informed in a way that makes them want to have the vaccine rather than feel like they're obliged to have it.
Yes, that's so interesting. That's unbelievable. So is that now active? Could that now be done for the next possible pandemic?
So it's still in production. Right. So I devised the test and it was going into production.
Wow.
And we're now in clinical trials for that. But I've moved on from that company.
But you've moved on. Of course, you've moved on.
Yeah.
You and your attention span, honestly.
a little bit, yeah.
So that, just before we move on for that, so is that IP is yours? That is your test that you developed?
Yeah, I developed it, but it's part of the company though. It's not my specific IP.
That's a shame.
That's
a shame, isn't it?
But on the back of that, we were able to float the company on NASDAQ, which was really quite a positive thing for us.
This is what we spoke about before. So yeah, tell me that story, because that must be awesome to go through that. Floating a company is not done by. It's not afforded by the many, is it? Like to float a company. So yeah, tell us what happened.
It was mad actually, and it was quite quickly since I joined the company. So
sure.
So the company originally was a COVID test distribution company and PPE distribution company.
Yeah.
And they had supply chains out of Malaysia and China of really high quality PPE and testing. And we went for
I love, by the way, that you have to actually, and it's sort of a serious point, that you do have to kind of say, no, we were one of the high quality ones that was doing things properly. Like, we weren't trying to steal from everybody or do anything weird, or we didn't take any dodgy government contracts. It's like bizarre that we live in a world where you actually have to like caveat that. But
I know, it's kind of, it's mad.
What did you do next?
So at the same time, I was kind of doing another job as I was doing the NASDAQ one, because after the cancer one, I was scrambling around a bit because I was like obviously not getting paid, and like jumped on whatever opportunities I could. Thought this potentially could be a good opportunity in the NASDAQ one, which it did turn out to be, but also wanted to kind of follow something that was a bit more secure as well. And so I joined a company called Connected Life, and they're based out of Singapore.
Okay.
I was their chief scientist and product officer. So developing a product that allowed for patient monitoring outside of the clinic. So when you're with a doctor, they can give you a care plan. They can give you everything you need to be doing to improve your health in a specific area. But once you leave that clinic's doors, they've got no idea as to whether you're being adherent to that plan and how you're doing until you come back in and see them in 6 months or a year. And often people might be like extremely motivated in the first week or two to follow the doctor's orders, take their medications, do whatever the doctor said in terms of like exercises and this kind of thing. But after 2 weeks' time, it drops off.
Yeah.
And sometimes it drops off significantly enough that like the next time you come in to see your doctor, you've not improved, or you've even got worse.
Yeah.
And it's like kind of a constant cycle of trying to get patients to adhere, but then eventually they'll just get worse and worse when they're not adherent between visits. So developed a platform that can use wearable tech to help monitor patients between clinic visits, and also deliver a care plan to them so that they can measure their adherence, and also alert themselves, anyone who's monitoring their platform, so you can have like your spouse or friends involved as well to keep you on track, and also alert your clinician if it gets to a stage where you're slipping further than you can manage yourself.
It's a heck of a red thread to start pulling. I say red thread. It's just a heck of a thread to start pulling. That when you start pulling on adherence and where adherence becomes about behavior, and it becomes about psychology, and it becomes about motivation, and it becomes about so many different things, and it becomes about the quality of information, the delivery of information, the touch points, the human interaction, the app interaction, there's so much that ends up becoming like. What was your particular angle on it, would you say? Where was your kind of expertise as a company like approaching that from?
We were solely looking at things from kind of a non-medical standpoint initially, but using kind of consumer grade technology like wearable technology to determine as much as you can on someone's health in between those clinic visits to keep them on track as much as possible.
So was that a closed loop between them, the device, and them, and then you would just fire off insights back to the clinician where it was needed, so the clinician wasn't responsible for the feed of data or anything?
No, the clinician wasn't responsible at all for that. And actually, the clinician had to opt in as well for receiving the alerts and things, because clinicians are very much overworked.
Absolutely.
Anyway.
Yeah.
And so that was one of the kind of sticking points with working with like large hospital groups, is actually getting the adherence from the clinician side, because they're like stretched as it is. So it's more kind of, it was more focused on trying to keep that patient involved and in the loop of like adhering to a care plan that was set, and then nudging them at specific points. And also we were developing some tools that could help the patient report on their kind of outcomes a bit better through the app as well, and also link in with things like their calendar and their kind of lifestyle to say to give them nudges at the most appropriate times. So for instance, you wouldn't get a nudge to exercise if you're on the tube to work in the morning, that kind of thing.
Because the detail of that stuff is so important, the nuance of that stuff is so important, and that's where I think so much of it, there was a huge boom of it when there was the first apps and the first this and the first, like it was very clear that we were so rudimentary in our thinking, like everyone trying to solve those problems, that there were so many assumptions made about you nudge someone and they do a thing. It's like no, it's not. It's nowhere near as straightforward as that.
No, and it's like often like you have to have something in it for the patient as well.
Absolutely.
If they're going to be adhering.
Yeah.
So it either needs to be a peer pressure from your family or your friends that try to keep you in line. So if you can add them as a viewer on your platform to say, look, you haven't taken your medication for 3 days. What are you doing? Then they keep the patient in line.
That would 100% be enough for me. That would 100% be enough for me, because you don't. yeah. It's just you don't want to give away any leverage there to those people. So yeah, absolutely, you just do the thing.
But then it's either that kind of pressure from people that they trust in their network, or it's a financial reward for doing something. Yeah. Or even a punishment on the other side, but I would prefer the rewards, to be honest.
Absolutely.
Yeah.
So what are you up to now? Tell me about your longevity company that you've got in the space and everything you're doing in the like future of longevity stuff.
My most recent company is called Freyr Health, and it's more involved with population health management and medical data rather than longevity, but it's all a continuum that feeds into each other. So if you're if you have a fuller, more richer data set that you can look at longitudinally from when you're younger, and then see any changes and kind of trends that link into your health as you age, this is the most important thing that you can be doing to identify areas you need to focus on for your longevity.
By the way, just to interrupt you, sorry, Tomasz. What that has just made me think of is, I have a 9-month-old son, and he is born now, and he was born into a world where ChatGPT exists, and we're even in the rudimentary stages of what ChatGPT even is. But even if it was to stay exactly as it is now forever, he would literally have an AI companion that knows absolutely and remembers absolutely everything about him from the moment he is born, and in sort of LLM terms, to help him with decision making or like whatever it is. Like he literally would have the data, all the data of everything he's ever told it from birth onwards. And so this is really interesting to me, of like this vision of what if all healthcare data of someone was captured, and you could query it, and you could run experiments on it, and you could use that population level. So please continue.
Yeah, just on a tangent with AI slightly at the moment. One of the, I think at the moment, the way our AI is being used is potentially the most dangerous point in time for AI.
Oh wow, okay, interesting take.
A lot of people are concerned about AI in the future and how it's going to affect their lives, but I think putting too much weight into AI right now is more concerning, because AI is only as good as the training data sets that you put into it, and at the moment those training data sets aren't good enough.
Right.
So
for what?
Or they're very,
are we talking about healthcare here?
For healthcare, for anything.
For anything,
really.
Okay.
And I think you see this in social media as well, where you have kind of your AI generated content that you're delivered all the time, but this becomes a bit of an echo chamber based on what you've been feeding it before, and it's not broad enough to expand to the wider remit of data that it needs to take in to really get you as a person and what you want to be viewing. Because most people, they fall down these rabbit holes of content, and I think it's they find it difficult to step out of that rabbit hole of content, because the AI has learned what it wants to be giving you, and it follows that same route. But it's the same with healthcare, actually. And if you have set data sets from a population that aren't representative of the global population, or aren't representative of a disease population group, the AI is going to learn on that data set, but it won't be representative of the population at all. So the more data we can feed in, the more relevant data, should I say, that we can feed into an AI, the better it's going to become, and then the more we can rely on it down the line. And this is especially true for healthcare, where even 99% accurate of an AI isn't good enough in healthcare, because that 1% can't happen. And if the AI is recommending something in that 1% that's completely wrong, then who takes responsibility for it? And that's the problem with healthcare AI. It needs to be 100%, or it's not good enough.
Who should take the responsibility for that, do you think?
I think it needs to have that oversight from a clinician. So if AI at the moment, and I think for a long time down the road, should only be used as a clinician support tool, but the clinicians need to have the final say, and it should be on them if they're not picking up that the AI was wrong in that 1% of times.
It's hard though, that I totally hear what you're saying, and I probably would say exactly the same thing if asked, to be perfectly honest, because you don't want to stifle the innovation, and you want to make sure. It's a problem though, I think, when at the moment the major application of that is, the major application of that is obviously, let's take summarizing notes, right? Summarizing clinical notes and providing, action plans and all the rest of it. the goal of that is obviously to take the cognitive load off clinicians and to increase the speed and to reduce the administrative burden. And it's funny because the and I'm speaking from personal experience now. Part of it is an administrative burden. Part of it is also you were told, or I was told anyway, to always write your medical notes on a patient as if you're reading them out in court. And when you outsource both of those loads, the administrative burden and the fear of legal burden, happy days. But if we're outsourcing the admin burden and saying, okay, AI is now going to write all your notes for you, but you've just got to check them and make sure that you didn't miss anything. I'm going to be like, I've still got now the legal burden, and it's like, has that actually solved my problem? And that for me is really difficult, because did I ask about PR bleeding? Like, it's not in the note. Like, it's not in the notes. Like, did I? Or I've mentioned it here, but did I ask now, like, so now I've got to think in the moment. I've got to remember all of this, and if I need to remember it, I'm gonna have to write it down. So now I'm back at square one. So it's a really interesting time. And then, of course, if you're expecting the AI to do complex calculations and you're gonna trust the signal, then now we're in medical device territory. So it needs to be a regulated medical device, and now it's not the support tool. So it's a minefield. But back to your original point, it backs up what you said, that we're in a very dangerous, potentially quite dangerous point of AI with this. And I'm really, really, really trying to like push hard on put AI where it's good and where we trust it and where it's okay, so that we can be freed up to do the other stuff. It's just that, I've been sat on that thought for a long time. Actually, I'm glad I've actually finally now said it out loud, that I do think that it feels to me like a bit of a problem. I don't know.
Yeah. So, well, one of the things with my latest business actually is trying to solve that problem to a certain extent.
Interesting.
So, so when you look at the health data that's available at the moment for a patient for clinical decisions, clinicians make their decision on about 3% of healthcare data that's available from a patient. And when you look at the rest of the data that can be captured from things like your risk determinants from kind of your health, your living, just like real world outcome measures, like wearables and health apps, genomics and metabolomics, then all of the other data that you can capture in everyday life from a patient, including patient-reported outcomes and things like this, that makes up 97% of a patient's health data.
And just on that, just if you could just talk briefly about genomics and metabolomics.
So genomics is looking at your genome and how that affects your risk profile for diseases. And metabolomics is looking at your basically the proteins in your body and how they're interacting and how they increase your risk for disease as well. So for things like
from the word metabolites,
diabetes development, metabolites, things like this. Yes. And we can detect and test all of these things, but it's not something that's done in a 5-minute conversation with your doctor when you go and see them.
No.
So in that 5-minute conversation, the doctor has to get as much information as they possibly can from you to make a diagnosis. And that's often on information that may not be true that you've remembered. You often remember the last kind of few days where you might have had a symptom and that caused you to go and see your doctor, but you don't remember what you were doing 6 months ago that could have actually affected your health today in a more longitudinal fashion. And so that doctor is doing the best with the information that they have, but essentially that's only 3% of the health data that's available for that patient. So what we're trying to do at Freyr Health is to allow that patient to aggregate all of their health data into one place to form a single, complete, portable medical record, or universal patient health record is what we're going to call it. And this allows that patient to unlock access to that full data set and get insights. It allows them to share it and leverage it and earn rewards from sharing that data as well. So we're essentially empowering patients to aggregate all their data into one place and then utilize it to its full extent either by sharing it with their clinician so that the clinician gets 100% of their data as opposed to just 3, or you can share it with pharma companies, like clinical trials companies, governments, insurers, and you can actually sell your data to those companies. But also for those companies themselves, they can access the data as a full data lake and use a anonymous access protocol that allows them to ask questions of the data without the data being shared, without any of your personal details being shared, and without the data actually moving from its location where it was captured. So the pharma company can get an insight from your data without actually any of the data being compromised. Then if they want to access your full data set, they can send a request to you to opt in. Then you can opt in, immediately share your data, and immediately get rewarded for sharing that data as well.
I think it's super interesting, and it's certainly not the first time I've heard something similar, and it won't be for you either, because there was a group of companies that were talking about this in the kind of Web3 blockchain era that I know you and I have spoken about before. And I can remember back then there were these nebulous concepts around Web3 and things existing in a something with a crypto key and people giving access to certain things based on that. And I remember it being talked about then, but never being seen through. Even like Tim Berners-Lee, like the founder of the internet kind of thing, was being talked about at that time as well as being part of this thing. Like it was a strange sort of movement, but seemingly with the same goal of like, how do you basically, now that we're in a world where people understand that data's valuable and they can understand and appreciate some more transparency around this, and everyone can kind of get on board with that. Well, is there a model now where we can go, okay, I'm now choosing that my genomics, my metabolomics, my heart rate variability data from in fact, all my wearable data from my phone and my watch and my all sorts, I'm going to put this all in a vault, and then that vault can be accessed by whoever it is, but I'm in control of the deal. I'm in control in what you pay for it and all the rest of it to some extent, obviously. But the point is that I'm always in control of that and I own it. And I think that's a really, really, really interesting concept that I think, having not actually heard about that in 4 years, I think was the last time I seriously heard about 4 or 5 years ago, like a credible boom in that. Come a long way. I think the world's got a lot further. Large language models now exist and everyone's more comfortable with AI and data and all these different terms, that it seems like now feels like a good time. I guess if you could explain, you said all that unified data in one place. I'm interested. What is that one place? Where does that exist? And yeah, like what weird dimension, Stranger Things upside down does that live in? Like,
so actually, that's the I think one of the issues with the adoption of this in the Web3 space is the kind of the one place idea.
Okay.
And that in that actually it costs a lot of money to store things on blockchain and using Web3.
Yes. Okay.
And all the regulation costs a lot of money as well.
Right. Okay.
So it becomes kind of a bit cost prohibitive when you store it in that one place.
Okay.
But if you store it in the area of origin for those data points, so the data points maintain their sovereignty and security in the data in the place where they were captured.
Yeah.
So if I travel globally and I go to New York one day and I went to a clinic there, I have my majority of my records in London, but then I also go to Dubai and visit a clinic over there.
Yeah, and your step count is.
I would have my data in 3 separate places.
Yeah. Okay.
But actually, the way that I would then aggregate them and look at them as a longitudinal health record is I would have on my Freyr Health app a token essentially with blockchain that identifies using hashes on the blockchain, which is basically hashes a kind of a location tool that identifies what data point should be at what point on your blockchain.
Yeah.
So you can use those hashes to then say, like, I've got 10,000 data points in Dubai, 20,000 from New York, and 200,000 from the UK. Like on that chain that's on my device, I can see exactly which point is where and which order they come in. Then I can use a peer-to-peer sharing mechanism that allows for that data to be streamed to my device without it actually having to be stored elsewhere, separate from where it was originally captured. But then you can still view it, and you can choose to share it from your device. And it that maintains GDPR and HIPAA compliance, which is the key kind of compliance factors for data security and capture within its area of origin. But then it also allows for the patient to view that data longitudinally, share it with whoever they want to, and gain insights from it as a whole, as opposed to it being siloed in these disparate places.
Wow. So when we talk about one place, we're not talking about metaphysically one place where all of this stuff is sat and at risk of attack or anything like that. You're actually saying keep it where its origin is, but aggregate is probably the wrong word, but ultimately you're accessing it from one place, and the access of it comes from one place from the sounds of things. But you obviously know where it all is, and it's all queryable, etc., etc. And the interesting part is that it's part of then this data lake. Now that's a really interesting element to this, where then you're not having to think about, or maybe you are thinking about anonymization or pseudonymization or any of that sort of stuff. You can actually just let people query the database and never have access to the data, so they can ask their research question, but you're not having to hand over all of the data. And actually that can then in your model come at a higher price if indeed they want that, if I've understood that correctly.
That's exactly it. So as a pharma company, if I was doing research on diabetes, for instance, I could say, I could tailor a query within the platform to say, actually, I want to look at all patients who are between 30 and 40 who have diabetes type 2 and are taking Wegovy to try and manage it, and also have been reporting on their glucose levels at least once a week for the past 3 months. So you can actually tailor it in a way that allows you to find the population of patients that are going to be most beneficial to you. Then it will access that data lake using that query, and you can ask a question of that data, like how many patients fit that criteria, and it will then query the data without any of the data moving, being shared, or any of the personally identifiable information being shared from those patients. And the pharma company will get a response to their query to say, actually, there are 100,000 patients that fit your criteria on the Freyr platform. Do you want to set up a study for these patients? Then if the pharma company is running a study on 10,000 of those patients, you can send a notification to all 100,000 to say, there's a study running from Pfizer. Would you like to opt in and share your data? And you will get rewarded for sharing your data with $100 per year. And then immediately those patients can choose, am I going to opt in or not? If they choose to opt in, they become one of those 10,000 patients. When the 10,000 patients are filled, the rest of the patients who hadn't opted in get a notification to say, actually, recruitment's finished. Welcome to try on the next one.
I really like it, man. The question I have is that how do you get the how do you get the critical mass of people on this to make it then valuable to those enterprises, those organizations, and to actually, because I imagine there's obviously the key bit here is getting people on the platform, because then ultimately there's a point at which you get to critical mass where the insights are valuable beyond, before which it's not really, but beyond which it then just takes off. So there's a point of takeoff, isn't there, I imagine? Do you know where that is and how you intend to get there?
It comes in stages, actually.
Okay.
So initially, we're partnering with a number of healthcare companies to allow them to access all of their data. But then we're also contacting governments specifically for this as well. So I'm actually working with the UN at the moment. I'm setting up a commission to promote this kind of data access to all 193 countries in the UN.
Wow.
And we're going to basically promote them to adopt a more digital health reform using our platform.
Interesting.
And an initial kind of investment for that digital health reform can then be offset by the data sales and the revenue that you get from selling that data to pharma companies and to research organizations. So essentially, it'll be setting up a new revenue stream for these countries, and which will offset any digital health reform that they need to pay initially to kind of set up. So that's the idea, and we're working with the UN at the moment for that. We're working with a number of NGOs in Africa, where we're negotiating access to the Pan-African Parliament's medical records. So they potentially will be giving us access to 1.2 billion records from Africa. But then we're also focused on individual healthcare companies to access their data that they have sitting in these siloed cloud repositories and not really knowing how to monetize it or do anything with it. So we can provide that platform for them to actually gain more from their data, get more insights on their data. And if you're a healthcare company, say in the longevity space, where you're capturing lots of longevity data for patients, but you may only have 10,000 patients on your platform, we can aggregate your 10,000 patients with another 10 longevity companies who also have 10,000 patients to give a 100,000 patient pool of data that then becomes more valuable for pharma. And then when pharma buys that data packet, you can share the profits between the different companies and the patients that have originally donated that data.
Yeah. And fair to say there's like a global health piece there as well around like the data gap of the lack of data around, underrepresented communities, basically, which clearly this helps to solve.
The latest research I was reading on this was that 80% of the global health data is attributed to people of Western European origin.
80.
And people of that origin only take up 16% of the global population. So there's a big data gap here in terms of the data that's being used to influence medical terminologies and processes, and also train AI models. All the clinical processes that are derived aren't really derived on a representative population globally. They're derived mainly on Western European populations. So if we can go some way to addressing that data gap and making it more representative of a global population by aggregating data from some of these underserved populations globally, it's going to go quite far to improving the models that we can use globally for healthcare. And again, linking back to the AI points that we mentioned earlier, we need the right data to be training these AI models to make them effective. And if it's trained on the data lakes that we have currently, it's going to be effective maybe for European populations, but not globally.
Absolutely. Very true. And thank you for saying that. Tomasz, I know that we've run over massively here, so I need to start wrapping this up and let you go.
It's been fun.
But before I let you go, one more question is around, can I ask you to help me with making my dog live forever?
Actually, yeah. So I'm working with another company. So one of my colleagues from the Nasdaq business, a guy called Cameron Shaw, he's set up a company called Panio, and it's based in UAE, but it's a dog longevity company. So I'm involved with adapting longevity treatments from humans to dogs.
Wow.
That we're going to have in clinics in Dubai initially, and then in Geneva and other places. But we're also in studies at the moment that are looking at the effectiveness of a drug for longevity in dogs. And it's been tested in rats and mice so far, and in rats and mice, it's improved the longevity by 30 to 40%.
What?
And insane. But this is small studies so far, I have to caveat. And now we're testing it in dogs, and the initial results show about 10% improvement, but we're now going to look at it across different breeds, and then take it to market. It's probably going to go to market in about 2 to 3 years, but it's looking quite promising. And then after using this in dogs effectively, we hope that it's going to be translatable to humans too.
Wow. Unbelievable. Can I ask you what metabolic process you're going after, or which aging process you're going after? Can I ask you that?
So it helps with the senolytics,
Okay.
like I was talking about earlier, but also it can act like a fasting mimic as well.
Interesting.
Because when people fast, they improve longevity. But if you can have a drug that makes the body think it's fasting as opposed to you actually having to fast, it's going to be a lot easier to adhere to.
Absolutely. Why do the work if you don't have to?
Exactly.
Dude, it's been an absolute pleasure having you on. This has been a very long one, so congratulations to anyone that's made it to this point, listener-wise. For people that want to get in touch with you, mate, or they want to learn more about anything you're up to, what's the best way for them to find you?
Find my latest business. So it's freyrhealth.com, FREYR. And yeah, feel free to send me a message on freyrhealth.com, please.
Amazing. It's been a pleasure, mate.
All right, been lovely. Thanks, James.